More than 11,000 athletes will take part in the Tokyo Olympics starting this week, but while most participants will be vaccinated against COVID-19, the shots have not been required, fueling public health concerns and the likelihood that more will have to withdraw, like U.S. tennis star Coco Gauff, when they test positive. More than 80%. That's the percentage of Olympic and Paralympic athletes that are estimated to be vaccinated against COVID-19, the IOC projected in June. That number may now be higher. As the IOC told Forbes in an email Monday night, it has received assurances that at least 85% of delegation members from countries' national Olympics committees have been vaccinated. Individual sports teams may also have higher vaccination rates. The Washington Post reported in June 90% of athletes on the U.S. Olympic swim team were vaccinated. For instance, while USA Today reports the U.S. men's rugby team collectively agree that vaccinations were an overall positive. With the period going into Olympic trials, I didn't want to risk any time out of the pool, Andrew said on Fox Business last week about his decision not to get vaccinated, saying he believed getting the shot wasn't necessary. Going to the games not only unvaccinated, but as an American, I'm representing my country in multiple ways and the freedoms we have to make a decision like that. COVID-19 vaccines are broadly protective against the coronavirus and are highly effective at preventing severe illness and death, including against the highly transmissible Delta variant now spreading worldwide. Breakthrough infections are possible if rare, however, meaning Olympic athletes may test positive for COVID-19, and have, even if they're vaccinated. The Associated Press reported Monday U.S. women's gymnastics alternate Kara Eaker tested positive for COVID-19 despite being fully vaccinated, though Eaker's family told KMBC the 18-year-old gymnast is so far asymptomatic, and Czech volleyball player Andrej Peruzic also tested positive Monday despite being vaccinated. Public health experts have widely condemned the decision to move forward with the Olympics amid the COVID-19 pandemic, and several criticized the IOC's playbook laying out its Olympic safety protocols and lack of vaccine requirements, in a July article for the New England Journal of Medicine. We believe the IOC's determination to proceed with the Olympic Games is not informed by the best scientific evidence, the experts, from the Icahn School of Medicine at Mount Sinai, the University of Minnesota and University of California, San Francisco, wrote. The IOC's playbooks are not built on scientifically rigorous risk assessment, and they fail to consider the ways in which exposure occurs, the factors that contribute to exposure, and which participants may be at highest risk. U.S.